I spoke on change management and leading physicians through change management. And the reason why this is important is because as chief medical officers, that's our primary job, is to lead change in the organization. And it gives a background on the reason why we have to be top in understanding the change process and being effective change agents. I think we have to think about how either operationally, how clinically, how work-life balance, all of those things technology can serve. For example, AI can help improve the workflow. Thinking about the patient, the provider, thinking about the quadruple aim of healthcare, and thinking about, are we going to make the clinical outcomes better? Are we going to make the patient experience better or the provider experience better? And that should be the aim when you are bringing in the technology. It shouldn't be just for the purpose of bringing in the technology because it's a new gadget. We have to think, how is this advancing our healthcare mission? So I think one of the big areas that we talked about at our conference is about essentially the face-to-face feel is really important. What has happened in the past 3 years with COVID is that there's been a lot of remote work and a lot of Zoom meetings. We are people who need face-to-face contact, face-to-face interaction. We learned a lot about the importance of either through lunch, through coffee, through that engagement, that face-to-face contact, that communication is really key. To clearly listening to your team is really important. Hearing what they say and communicating. Communication is a two-way stream, so not only communicating to them your needs, but hearing from them their thoughts, their concerns, and taking that into account is really important in terms of building teams. And then the third area is also having fun. We spend more time at work than we do at home, actually, and creating an environment where people feel comfortable speaking up, where people have psychological safety is key. And now with the new generation of workers that we have, the new Gen Z, you have to be even more adept at that because they have placed work-life balance as a very high priority. And if you want to retain your workers, you have to be understanding of how do we engage our employees. And team building is the key feature. So I think you need to have, number one, set a vision, explain what's in it for them, and then what's in it for the patients. All healthcare workers have as a mission to help people. That's why we went into healthcare, is to help people. And if you remind them how this strategy that you're trying to bring on is helping the patients, which is what's in it for them, or this new strategy is going to improve the operational efficiency in the hospital, or help support the mission of the hospital, I think that's key as a CMO to engage in the change process, is reminding them why they went into healthcare. It's to help the patients, and somehow connecting it with your patients or your mission of the organization is key to drive that.